come up next to my receiver, basically hip to hip, butt to butt, just scooch on in, let her know that I am here, that she is fully supported. And then I'm going to take my hands, I'm going to come in underneath this arm, say hi. My hands are going to say hi together, and they're going to grasp the shoulder cap. So right in this area. A lot of people like to come up on the neck, totally fine. Some people closer down on the shoulder, totally fine, just whatever feels good. I have a tendency to make sure that I'm grabbing the shirt, not grabbing the collar, because nobody likes a stretched out collar. Also be mindful of any bra straps or any supportive undergarments. So again, gonna come over here, grab right here onto the shoulder cap, and I'm just gonna lean back, and you'll see how her head lifts and we get that beautiful extension through the neck. I'm gonna lean back. I'm not pulling her, okay? My arms aren't that strong, but my body is. So I'm gonna grab and I'm gonna lean. How does that feel, Kristen? So as you can see, I'm sitting kind of like weird side saddle, I'm unsure. This feels good for me. I move my legs around a lot, whatever works for you. I'm gonna lean. And then I also like to take and grab and pull back onto my knee. And you'll see we're getting more extension and movement through that neck. And it eventually looks like a giant kind of circle. This is the way I work. Just like this. So once we've had a chance to really open up that neck, I like to come in with a flat palm and just move the shoulder around. It's a little more jostly, but I like to get that big movement through that shoulder girdle, because usually they're really tight, and the scapula, the shoulder blade, loves to get stuck onto these ribs back here. And so we're just gonna be like, hey, get up. You can also take your fingers or your knuckles and go all around the outside of that shoulder blade.
That's nice.
Just right along that. It's called the vertebral border of the scapula, or we just say shoulder blade, part that's closest to your spine, whatever works. Now, you'll probably feel on your receiver this like denser tissue, what a lot of people call knots. And that's fine if you just want to like hang out there, do little circles. As you can see, I've got my arm braced against my leg. So I'm not using my arm strength. I'm using my leg. I'm hooked in. Everything's kind of stacked. I'm just leaning, just pushing with my leg to get a little bit extra pressure, because I know that Kristen likes that. How's that feel, hon?
Muy bien.
Good. Move all around. Again, being mindful of any supportive garments underneath. Ooh, right in there. And I'm using my top hand or my inside hand to support the shoulder as we go around. Up and around. And when we get closer to the top, you're going to see, you're going to start feeling traps or trapezius. This guy's always angry, always causing problems. I like to grab and pull back a little bit. I'm a big fan of grabbing and pulling. You'll see she gets all that movement in there. As I pull her back like this, a lot of receivers will also feel a stretch in their pecs. As you can see, we're creating a lot of length through their pecs. You can take your inside hand and shear down a little bit if that feels comfortable to you and your receiver. To see how her whole arm is moving? It's because I'm engaging pecs, pec major and pec minor. There you go, pec minor and pec major on the screen. You can see how big they are. Well, pec major is big, pec minor is kind of small, but either way, he needs love. And they're real strong. They pull the shoulder forward, which stretches all these back muscles forward, and they don't want to be forward. They want to be back here because, you know, they're back muscles. That's where they should hang out, right? So do our stretch, do our movements just like that. So one of the things that I like to do then is I like to come in, kind of do hip to butt or hip to glutes, grab her arm, and then do some traction. I like to support her lobe or her back as well, just so she knows that I'm here. I'm not a ghost grabbing on her. Big deep breath, Kristen. And I grab and I lean, just like that. Ooh, I feel her tensing up, tightening, and then she'll relax into it. Big deep, oh, there you go. Getting some length. I'm just leaning, hanging back. Some receivers, I can lay all the way down. Some receivers, I'm like, hey, this is about it. Kristen, we're at about here. Ooh, how's that feel?
Good.
Good. So once I've got that shoulder girdle all nice and loosened up, you know, we've done the pecs, done back here on the shoulder, it's all floppy-doppy, right? then I like to come in more with my soft elbow. You can definitely come in with your knee. I don't feel like doing that today. I'm going to show you an alternative that works well for me. So now your receivers sometimes wear necklaces, Kristen. And
Always wears necklaces.
Yeah, they always wear necklaces for some reason, especially when they know they're getting neck work. It's like she got a sunburn on her neck too. So we're gonna have to work around that. Make sure that you work around that with your receiver. You know, I'm just joking with you, right?
Yeah.
Okay. So what I like to do is, again, take the soft part of our forearm of our elbow right here, and I'm gonna press it in here. You can see the traps. SCM is right here. You can see the top of traps. It's like right in this area. We're gonna press in and then pull back with the flat, soft part of our forearm or elbow. So again, press in and pull back. If we go forward, there's muscles there and do need work. This isn't really the best area to do this with your elbow because, you know, does anybody like a blood clot? Would you like one?
No, I'm good.
No? Okay, so no blood clots today. So again, we're gonna come in, press, and then pull back. So I'm gonna take soft part of my elbow, hook in, and pull back. How does that feel?
Good.
So the motion that I'm doing is down and towards me, and then to really get some pressure, I like to hook into my arm and then lean back. How does that feel?
Good.
Would you like more or less pressure?
Yeah. More, please.
Okay, there we go. So for this,
yeah.
I know, right?
Sorry.
Some pressure. So as you can see here on the screen, you'll see those anterior and front and side muscles, as well as the trapezius. We're working on traps attachment right now, and I'm just hanging out. So as you can see, I'm on traps here, right in this area, kind of at the base of the skull, but it's going to go all the way up. I'm going to have her take a big deep breath in. And then I'm going to press in even more. And as you can see, I'm at your edge, cool.
Yeah.
As you see, I moved my leg out of the way so I get a little bit more downward pressure. And then I'm just going to hang out here. This is what feels comfortable to me. And this is what I like to do. Now this is where you also want to check in with your receivers, because as you can see, there are a lot of muscles going on here. And when there's a lot of muscles going on, they have a tendency to get very angry very quickly. So we want to take our time, do lots of breathing, checking in, seeing how our receiver is doing, seeing if they'd like more or less pressure. If we went back, would you like it to go back?
Sure.
Okay. We can go up towards the head, and you'll see her head move very slightly. Do you like that?
I do.
So she likes that. That's where we're getting a little bit of those side occipitals, those tiny little muscles at the base of the skull that usually cause migraines. Yep, they're right there on the screen. And we're right on the edge of some of those guys where they like to attach. And I'm going to pull back just a little bit more to hook into them just a little bit more with a nice sharp point of my elbow. How does that feel?
Intense.
Good. Big deep breaths. Good job. Okay, big deep breath in. All right, so now I'm going to come out very slowly. Whenever you're dealing with necks or really holding any intense sort of pressure, you want to come out slowly. It can be very jarring to the nervous system to have a lot of pressure and then just bounce out. And the body's like, oh no, what do we do? It's like, no, fam, we're okay. So this is where Kristen and I differ a little bit. I like to use my hands a little bit more on this neck area. So I'm going to show you some of that. So what I like to do is, again, come in, hug this arm. This makes her feel safe and supported. I also usually give my clients a blanket because they like to sleep, but we're not going to.
They like to sleep.
They do like to sleep while I do this. So they're very weird. But I love them. I love you guys. No, I can work around it because, you know, our receivers will, you know, have sunburns or wear necklaces and it's just stuff you work around. So not a big deal. So with this, you can get a little bit of lotion or a little bit of Glide, something like that. But usually the oils, the skin's natural oil, will work out fine and give you the Glide that you need. Just be very conservative with it, because if you go to do anything else and your hands are all oily or greasy, stuff's just going to start sliding around. We don't want to do things and lose our receiver somewhere. So I like to come in. And again, I personally like to shorten the neck at first. Hook in right here to the top of SCM. So once I've hooked in, I like to grab the shoulder and then pull back. And this is a pin and stretch. How does that feel? And then I'm slowly sliding my thumb up to her occiput, and then back to these suboccipitals. This is how I like to do it. Some people have very dense necks. That's just how they're made. That's how they like to work out. It's all great. In that case, for a very dense neck, I would most definitely use a knee or an elbow, not my delicate little fingers here. So while I'm hooked in, I like to move the shoulder around